Hey everybody, and welcome back to the channel. For those of you who are new here, my name is Dr. Todd. I am a board-certified internal medicine physician working in primary care. And today's topic is one that is very near and dear to my heart. See, as a primary care doctor, I'm terrified about the future of healthcare. For a lot of reasons, really, but the one we're going to cover today is the crisis of access to care. See, 1 in 3 Americans don't have a primary care doctor. That's over 100 million people rolling the dice with their health. But here's the kicker. Not only are many skipping out on primary care, but soon, finding a doctor may be even harder. And by the end of this video, you're going to see exactly why that is such a big deal and what you can do today to make sure you don't get caught in this crisis. So stick around because this is information that you can't afford to miss. So what's the big deal? We're heading straight into a primary care crisis. By 2036, we could be short up to 55,000 primary care doctors, meaning longer wait times, fewer available appointments, and an already stretched thin system getting even worse. So why is this happening? Well, fewer medical students are choosing primary care due to lower pay and higher workloads. Also, as the population ages, demand skyrockets, and supplies just isn't keeping up. Rural areas and underserved communities are often hit the hardest, making access even tougher. So in our first podcast episode, we talked about what it means to live well. And a huge part of that was having a doctor who knows your medical history. But so many people avoid it. Either they feel fine, don't think they need one, or just don't want to deal with the healthcare system. And hey, I get that. But here's the reality. Your body isn't a car. We don't have a check engine light. You don't always get a warning before something serious happens. And the numbers, they don't lie. A study in JAMA Internal Medicine found that people with a primary care doctor have better overall health outcomes. This includes lower rates of heart disease and cancer-related deaths. Those with regular PCP visits spend 33% less on healthcare in the long run. Why? Well, because some of the time we can help to avoid, say, expensive ER visits and potentially help avoid hospital stays. And another landmark study showed that people with a primary care doctor lived longer, an average of 25% increased life expectancy compared to those who didn't. And yet, a third of the country skips this completely. So what's the big deal? Well, it's about prevention. See, a primary care doctor doesn't just treat sickness. They help you avoid it in the first place. And preventative screenings, they matter. So colon cancer, high blood pressure, diabetes, these don't just show up overnight. They develop silently over years. Going back to colon cancer, for example, a routine screening can catch it when it's 90% curable. If you wait until symptoms appear, well, that number drops below 15%. High blood pressure. You may not feel it creeping up, but it's the number one cause of stroke and kidney failure, and it's entirely preventable, or at least treatable. And diabetes. By the time symptoms start, well, nerve damage, vision loss, kidney disease, they may have already begun. See, one of the biggest mistakes people make is assuming that feeling healthy means being healthy. But your body doesn't send you a notification when your arteries are clogging or when your blood sugars are starting to creep up. You know, the role of primary care is to help monitor subtle changes before they become big problems. You know, it's to track trends over time. You know, a single blood pressure reading really doesn't tell you much, but tracking it over a year, well, that can give you a lot of information. And the other role of primary care is to give you a long-term health plan, not just react when something goes wrong. So here's the harsh truth. Most people think they have more time until they don't. And I've seen this too many times. Patients wait, put off checkups, oftentimes for years because they felt fine, only to show up when something's really wrong. And by then, the options are fewer, the road is harder, and the regret, it's real. You see, prevention only works if you do it before you feel sick. So if you take nothing else from this video, take this. Your future self is counting on you to act today. So here's what I want you to do. If you don't have a primary care doctor, make it a priority this week to find one. Ask a friend for a recommendation, check your insurance portal, Do whatever it takes. If you already have a doctor, well, when's your next checkup? If it's been more than a year, call today and schedule it. Don't wait. And if you want more insights like this, subscribe. We go through some weekly breakdowns on how you can take control of your health. But before you go, I'm curious. Do you have a primary care doctor? If so, how often do you go? And if not, well, what's stopping you? Drop a comment below. I'd love to hear your take. That's all we have for today. Thanks for listening. And until next time, take care of yourself and be well.